My name's Jackie Sibson. I'm one of the nurses in the quality team, and part of my role is supporting the nurse revalidation process for the Trust. This presentation is for confirmers. There is a separate presentation with information for nurses and midwives explaining what they need to do to prepare for revalidation, and this can also be found on the Nurse Revalidation page of the intranet. Before listening to this presentation, it will be helpful for you to have these two NMC documents in front of you. These again are available on the Nurse Revalidation page of the intranet. The information for confirmers, as the name suggests, gives you all the details of what you need to do in the role of a confirmer, and the workshop materials are really helpful because they show what amount of detail the NMC wants on these forms and templates. So Nurse Revalidation starts in April 2016. It's a requirement for all registered nurses every 3 years at the time of their re-registration. It's linked to the new code that came out in February 2015 and was one of the recommendations of the Francis report along with medical revalidation. Importantly, it's not an assessment of a nurse's fitness to practice. These are the 4 themes of the NMC code, and nurses have to relate some of their revalidation evidence to these 4 Ps, and we'll be talking about those later in the presentation. And this is what the NMC feels is the purpose of revalidation. I do think that the role of the confirmer does provide additional assurance that the registrant has met the revalidation requirements, and the process also does encourage reflection, as you'll see later in the presentation. So this is an overview of the process. We'll go into more detail about each of the requirements later on. But first of all, nurses need to register with NMC online. So if you can encourage all your nurses to do so if they haven't already done that, there is a link to NMC online on the Nurse Revalidation page of the intranet. They need to record their practice hours, record their CPD hours and collect evidence that they've completed it, and collect 5 pieces of practice-related feedback. They need to write 5 reflective accounts, have a reflective discussion, have a confirmation meeting with you, and submit their application via NMC online. A proportion of nurses applying for revalidation will be subject to a verification process. The NMC haven't yet identified what proportion that will be. But if nurses are called back for that, as you'll see at the end of the presentation, this won't be of any concern to them. So the role of you, the confirmer, is to confirm that you've seen evidence that satisfies you that the nurse or midwife has met the requirements of revalidation. It's not to verify any evidence provided to you. So for instance, you don't have to check with any CPD providers that the nurse actually attended a course. The nurse should bring you all the evidence that you need to perform this role. It's not to make an assessment of a registrant's fitness to practice. If there is a concern about a nurse's fitness to practice, then obviously that is a separate process. The information for confirmers document we talked about, which hopefully you do have a copy of, is available on the intranet, and you do really need to have read that through before you perform the role. And obviously, as I said, the examples of completed forms and templates are really useful. So the first requirement is that a nurse should have practiced for at least 450 hours in the 3 years leading up to their revalidation, and this hasn't changed since re-registration. The hours should be related to their role, and they don't have to be patient-facing, but it must be in a role where the nurse relies on their skills, knowledge and experience of being a registered nurse or midwife. So in my current role in the quality team, I'm not seeing any patients as part of my role, but I am using my skills, knowledge and experience of being a registered nurse to do my job. The 450 hours isn't as onerous as it sounds. If you complete this over the 3 years, it equates to 3 hours a week. And if you work full-time and didn't have any annual leave or sick leave, it would take you 12 weeks to complete it. As before, if they haven't completed the required number of hours, they'll have to complete an NMC approved return to practice course, so there's no change there. Nurses can still revalidate if they're on or have had maternity leave during the 3 years, providing they've completed the 450 hours. They still do need to revalidate if they are, for instance, on maternity leave at the time of their revalidation date. They can't leave it until they return to work. Ideally, they'll have collected their evidence before they go off and will have to come into work to have the discussion and confirmation meetings. The keeping in touch days can be used for these meetings, and you need to negotiate this between you and the nurse. There is a practice hours log in how to revalidate with the NMC. This document has all the information that nurses need for their revalidation, and it's on the Nurse Revalidation page of the intranet. If you look in the workshop materials document, sadly there aren't any page numbers, but the first examples are of completed practice hours logs. This is an optional log, it's not a mandatory form, but it shows how much detail nurses need to provide about their hours. The first example you'll see has from the 1st of January 2015 to current in the dates section, and just full-time equating to 1,725 hours per annum in the number of hours column. So nurses don't need to record individual practice hours. The second example over the page just has community nursing as the description of work, so again they don't require a lot of detail. The NMC have said that nurses revalidating early in the process only need to work backwards with their evidence until they've reached the required amount. So a nurse could just log their roles until they have the 450 hours recorded. They don't need to start from 3 years ago if they don't want to. And in their online application, they'll have to declare that they've met the practice hours requirement and give details of their current practice. So you as the confirmer need to see written evidence that the nurse has practiced for the required number of hours. As I say, they can work backwards. And they also need to provide you with evidence to show what their role entails. The nurse should have a job description that outlines what the role entails, and could also bring their contract of employment or timesheets to confirm what hours they work, those detailed in their log. Page 15 of information for confirmers goes into this in more detail for you. Obviously only hours relating to registered nursing or midwifery count, so any hours done in another role such as voluntary work won't count. And if the nurse hasn't worked the required number of hours, you must be satisfied that they've successfully completed an NMC approved return to practice course. And on the confirmation form, you'll have to tick a box to say you've seen written evidence that satisfies you that the nurse has practiced the required number of hours. So the next requirement is that nurses must complete 35 hours of CPD in the 3 years leading up to their revalidation, and these must be relevant to their scope of practice. The NMC cite that some mandatory training won't, for instance fire training. So I can see that in my role at Howard Court, fire training wouldn't be relevant to my scope of practice, but if I was a nurse on a bed-based unit and needed to know how to evacuate my patients, then absolutely it would be. So it's just really using common sense as to whether it is something necessary for the role of the nurse. A new requirement is that 20 of these hours must include participatory learning, where the nurse personally interacts with other people. So for instance, e-learning wouldn't be participatory, reading an article in a journal in the library wouldn't be, but any course, any training that where the nurse is actually completing it with somebody else or even an online forum, then that would all be participatory. And there are examples for the nurse to look at on page 44 and 45 of how to revalidate with the NMC. Again, there is a non-mandatory CPD log template on page 52 of how to revalidate with the NMC, and an example of that is in the workshop material. So if you've got that in front of you, if you actually have a look, it shows you helpfully again how much detail the NMC want us to complete. So just the date, if you have a look, the method, so Safe Staffing Nursing Skill Mix Conference, the topics, the link to the code. So this is really helpful. This is the 4 Ps or the themes that we looked at earlier in the presentation, and where in this CPD log template the heading actually says link to the code, they're obviously just requiring that nurses write which of the 4 Ps or all of them that the particular training relates to. So they don't have to go into more detail than that if they don't want to. And then you can see they can just log the number of hours and how much of that was participatory. They do need to present to you their log of hours. As I say, it doesn't have to be in this particular format, but also evidence that they completed the CPD. There is a guide on how to download certificates from AT Learning on the Nurse Revalidation page of the intranet. And again, on page 44 and 45 of how to revalidate with the NMC, it gives nurses suggested evidence for each type of CPD. In their online application, they'll just have to tick a box to declare they've met the CPD requirements. They won't have to upload the evidence to the NMC. So the confirmer's role in this is that you need to see evidence of attendance or completion to confirm they've met the CPD requirements. And there is information for you on page 15 and 16 of the information for confirmers. You need to see details of the activity via the NMC optional log or some other format and evidence that they undertook the activity. You can ask for an explanation if you've got any doubts about the evidence that they're presenting to you. And on the confirmation form, you'll tick to say that you've seen written evidence that satisfies you that the nurse undertook 35 hours of CPD relevant to their practice, and evidence that at least 20 of those hours included participatory learning, and also accurate records of the CPD that was undertaken. So the next requirement, which is a new one, is that nurses need to get a minimum of 5 pieces of feedback over the preceding 3 years. And this can be from patients, service users, carers, students, colleague. It can be written or verbal, formal or informal, positive or constructive, and it can be related to that individual nurse, their team, the service, or even the organisation. The nurse is only required to keep a note of the content of the feedback and how they used it to improve their practice. And this is probably the vaguest of all the requirements for revalidation. There is no log that they have to complete. It simply says that they have to keep a note of the content of feedback. And this is going to be an easier process for nurses in some teams than others. Some teams get lots of feedback from their patients and relatives or carers. In some teams it seems that the feedback from the friends and family cards or from service user surveys are sent back to an administrator in their team and then forwarded on to the patient experience team. So I think we need to get smarter at actually forwarding that feedback back to the individual nurses or teams involved so that they've actually got copies of those. Thank you cards are fine, they can take those, and they'll just need to bring you evidence of that feedback. Of course, if it was verbal, then they're not going to have any evidence, but then what they need to do is keep a note of it. I've actually got a folder now in my Outlook where I save emails giving me feedback, and I think we just, as I say, need to get better at giving and keeping a note of any feedback that we actually receive. So for nurses, this could also be from students. You know, health visitors have lots of students and other services do as well, and it can also be from the nurse's appraisal. So any way that they actually get feedback, they just need to keep a note of it and bring it along to you at the confirmation meeting. They must of course ensure that no identifiable information is included, and for their online application they'll just tick a box to declare that they've met the requirements. They won't need to provide any evidence. So your role for this requirement is that you need to be satisfied that the nurse has obtained the 5 pieces of feedback, and again there's more information for you on page 17 of information for confirmers. If the feedback was verbal, the nurse should be able to give an account if there's no written note. You may need to provide advice to your teams on how to obtain feedback, and also we need to encourage teams to give feedback to their colleagues. On the confirmation form, you'll just tick to say that you're satisfied that the nurse or midwife has obtained 5 pieces of practice-related feedback. A new requirement is that nurses have to write 5 written reflective accounts over the 3-year period, and these should be reflecting on a piece of practice-related feedback, an episode of CPD, or an experience or event in their practice, or a combination of these. And there is a mandatory form that nurses must use for recording these reflections, which is found again in How to Revalidate with the NMC. If you have a look in the workshop materials, there are 5 examples of reflective accounts, which are really helpful in showing how much detail the NMC are looking for. You'll see that these don't have to be academic pieces. The first of the mandated questions is, what was the nature of CPD activity, feedback or event or experience in your practice? And you can see from the example that the nurse just needs to write however much it takes to explain this. It doesn't have to be pages long. The second question is, what did you learn from the CPD activity, etc.? And the first example just has bullet points for this section. Other examples later on have more detail, but again, this isn't a massive amount. The third question is, how did you change or improve your practice as a result? And the last question asks, how is it relevant to the code? These examples are particularly helpful here because they show that the nurse just can list which of the 4 Ps from the code the reflection relates to. They don't have to go into more detail if they don't want to. They must of course not include any identifiable material, and in their online application they'll tick a box to declare they've met the requirements. They won't have to upload the actual reflective accounts, but you as the confirmer will need to see them. So then the nurse needs to have a reflective discussion with their NMC registrant, and in this discussion they'll just discuss the 5 reflective pieces, and it must be face to face. So this discussion can be with their confirmer if their confirmer is an NMC registrant. If not, there is guidance in the Nurse Revalidation policy of who is a suitable reflective discussion partner for them. There is a mandatory form that must be completed to record this discussion, and there is an example of a completed form in the workshop materials. You'll see the example is handwritten, and that's because initially when the final guidance came out from the NMC last October, they said that this form shouldn't be saved or sent electronically. They've actually changed their mind on that, and it now can be stored electronically, but they just give guidance about making sure it's done safely because it's got identifiable information on it. For their online application, the nurse will just tick a box to declare they've had the discussion. They won't need to upload this form to the NMC. So you as a confirmer, if you are a nurse or midwife, you can have the discussion and sign the form at the confirmation meeting. But if not, you will need to see the 5 reflective accounts. You won't need to discuss them, but you need to see them and a completed form at the confirmation meeting. So this next 2 items aren't part of the confirmation discussion, it's just so that you're aware of them. As part of their online application, the nurse will have to make a health and character declaration, declaring that they're capable of safe and effective practice without supervision, and also declaring any criminal offences or cautions over the preceding 3 years. Importantly, any convictions should be reported immediately to the NMC at the time that they occur. And they also have to declare that they've got professional indemnity arrangements in place. Now, if a nurse works exclusively for an NHS organisation, then they will be automatically covered. So then you have the confirmation meeting, and this is where you confirm that the nurse has met the requirements of revalidation based solely on the evidence that they bring with them to this meeting. The confirmer will be the nurse or midwife's line manager. They don't have to be an NMC registrant, and that's recommended by the NMC, but also we've confirmed that in HCT's Nurse Revalidation policy. Nurses will only need 1 confirmation meeting, even if they have 2 nursing roles. They will need a separate one if they are also practicing as a midwife. So if they have 2 roles within HCT, they should have the confirmation meeting with the line manager in the role where they do the majority of hours. And even if they have another role in another organisation, then they will have one confirmation meeting in the role where they do the majority of their hours. So that could potentially not be with HCT. There is a mandatory form again for recording this, which the nurse should bring with her to the meeting. It's in How to Revalidate. But again, there is an example of a completed form in the workshop documents. And you can see, again, it's in the example, it's handwritten, but the same issue was with the discussion form, and it can now be, completed on the computer and saved and sent electronically. You can see from the example that you just need to tick boxes to confirm that you're satisfied that the evidence they've shown you confirms that they've met the requirements. Importantly, you don't need to verify any evidence. Like we said at the beginning, you don't need to verify, for instance, with a CPD provider that the nurse actually completed a course. The evidence that they bring you should be sufficient to satisfy you that they've met the requirements. This confirmation meeting can happen at any point in the 12 months leading up to revalidation, and ideally, as this process becomes embedded, it can happen at their appraisal in that 12 months leading up. So long as they've got all the evidence together, that will be fine. And they will need to enter details of their confirmer when submitting their application. You as the confirmer will be contacted if a nurse you've confirmed is chosen for the verification process, and the nurse should inform you if that's going to be the case, so that you can look out for the email and not hold up the process. So just a quick run through of what actually happens at the application process. The NMC will send the nurse an email 60 days before the first of the month in which the nurse is due to revalidate. So all nurses' revalidation dates are the end of the month. So for instance, the 27 nurses that we have in HCT who are due to revalidate in April this year, their revalidation date is the 30th of April. But they need to have submitted their application by the 1st of April. So really the 31st of March, and that then gives the NMC the calendar month to process their application. So when nurses register with NMC online, they have to provide an email address, and it's to that email address that the NMC send this email 60 days before. We've also found out, as this first cohort of nurses start to go through the process, that they send reminder emails throughout those 60 days as well. So then the nurse logs on to NMC online, that's why they need to have already registered, and they declare that they've met the practice hours requirements, but they don't need to upload the log or evidence. They declare that they've met the CPD requirements, but don't need to upload the log or evidence, and they declare that they've met the feedback requirement, but don't need to upload the actual feedback. Then they declare that they've had a reflective discussion with another NMC registrant, and they have to enter the name, PIN number and email of the registrant, but they don't need to upload the reflective discussion form. They'll make their health and character declaration and declare that they have professional indemnity arrangements in place. And then they finally have to declare that they've had a confirmation meeting and enter information about the confirmer, but again, they don't need to upload the confirmation form. The NMC have confirmed that nurses don't have to complete their application in one session. It doesn't, to be honest, sound as if it will take very long, but if something makes them stop halfway through, they won't have to restart the whole process. They will importantly be offered a chance to print a paper copy of their application for their records, and I think we should advise nurses to make sure that they submit this application on a computer where they're linked to a printer so that they can actually do this. They will then receive an email confirming that their registration has been renewed, but the NMC advise nurses to check their status on the NMC website. And we have heard of nurses where following their re-registration, they've lost, for instance, their health visiting qualification on the NMC website and have had to negotiate to have it reinstated. So I think again we should advise nurses to check that once they've gone through this process. So then, as we said, a proportion of nurses submitting their revalidation application will be chosen for the verification process. And if they are chosen, they'll receive an email within 24 hours of submitting their application. So at least they'll know pretty quickly. They won't have to keep checking that email address for the next 2 or 3 months. They will need to upload further evidence, but details of that is on page 35 of how to revalidate with the NMC. But this will only be evidence that they've showed to you their confirmer, so they won't have to be running around trying to get more evidence. It literally will be what they've shown to you. The NMC may contact their reflective discussion partner, but they will contact you as their confirmer, and that's why they should inform you if they're chosen, so that you can look out for this email address, because if you don't respond to the NMC, then it's going to hold up the whole process. And information about that is on page 18 of information for confirmers. They may also contact the nurse's employer. So that's the end of the process. On page 4 of information for confirmers, the NMC have stated that they expect confirmers to act honestly in good faith, but they don't intend to take action against confirmers who inadvertently provide information that proves to be incorrect. So if you are given information that looks valid to you, you provide confirmation, it turns out later on that it wasn't valid, then provided you've acted honestly in good faith, the NMC won't take you to task. So finally, all of the information about revalidation is available on the NMC website and of course our Nurse Revalidation page of the intranet. Do encourage nurses, or indeed get in touch with me yourself via my email address there if you've got any queries or concerns about the process. Thank you.